We're going to travel all the way to the West Coast for our first presenter. And we're going to now meet doctor and veterinarian, Dr. Andrea Fascetti, who will be speaking to us on the topic of allergies in cats and dogs. Now, a little bit about Dr. Fascetti. She graduated from the University of Pennsylvania School of Veterinary Medicine and completed an internship and residency at the Animal Medical Center in New York City. She holds a doctoral degree in nutrition from the University of California, Davis. Now, we couldn't read all of Dr. Fascetti's accomplishments, and she is very accomplished, but I wanted to point out that she is currently a professor of nutrition at the University of California, Davis, and she has authored over 60 peer-reviewed publications. That's huge. She's also co-edited a textbook entitled Applied Veterinary Clinical Nutrition, and she has served as the secretary and treasurer of the American College of Veterinary Nutrition and as a member at large on the executive board. Please welcome Dr. Fascetti.
Good afternoon. My name is Andrea Fascetti, and I'm a veterinary nutritionist at the University of California, Davis. I am here today and really happy to be here today for the Pet Food Institute's first regional webinar, Mania. And so I'm here today to talk about the nutritional management of food allergies. So oftentimes when we think about food allergies, what we're really talking about are adverse food reactions. And there are a multitude of different ways that you can have these adverse food reactions, but the most common ones and the ones that we often typically think about are those that are mediated by the immune system and are certainly mediated to develop what we call food allergies. So food allergy is really an immunological response that can be defined as an aberrant adverse response upon exposure to a food, often what we refer to as an antigen, typically in the form of a glycoprotein substance. So that's the most common way when we think about adverse food reactions. We're really talking about that immunological response associated with being exposed to a typical food source. Now, there are non-immunological responses to food, things such as simple ones like dietary indiscretion, often referred to as garbage gut in some cases. And then there are also different types of food intolerances as well. And that can be a pharmacological effect of a food source. It could be other types of things that cause an adverse reaction when you eat them. So what is a food antigen? We'll talk about antigens, and they're really glycoproteins with very small molecular weights, often ranging from 10,000 to about 70,000 Daltons. And oftentimes these glycoproteins are attributed to protein sources, meaning that the protein sources are the antigens. Now, it's not just proteins that can be antigens and cause an adverse food response. Certainly, we have seen this reported with legumes and tubers and grains as well. When we talk about adverse food reactions, they can present in a couple of different ways. One is presentation through showing dermatological disease conditions. That said, we can also have adverse food reactions that occur through the gastrointestinal tract as well, and this can present as vomiting or diarrhea. So there are multiple ways that adverse food reactions can present when you see them. So when it comes to adverse food reactions, what does the literature tell us about what the common antigen sources are when it comes to this condition? I have here on this particular slide, I'm reporting a study of food allergy in dogs and cats, a review by Verlinden et al. And this was back in 2006. And so in this 2006 review, you can see here that common antigens that were associated with adverse food reactions included for dogs, beef, dairy, wheat, lamb, chicken, and egg. For cats, the antigen sources are a little bit different, but some are the same. So beef again, dairy again, this time fish, poultry, and rabbit. Now let's jump ahead 10 years from the previous study to this one to see, again, what are the most common allergen sources when it comes to dogs and cats. And this is a 2016 report from Mueller et al. So in their results section, the search for and review and analysis of the best evidence available in 2015, when this paper was actually, when the data for this paper was collected, suggests that the most likely food allergens contributing to canine adverse food responses are beef, dairy products, chicken, and wheat. When it comes to cats, again, it's a little bit different. Here we have beef, fish, and chicken. So the common antigens in some cases have remained pretty the same over this 10-year time period between cats and dogs. So antigens in pet foods. The commonly used ingredients in pet foods, cat and dog foods, change over time. And some of those changes are in response to what pet owners want to feed. Sometimes it's in response to what's available and what can be used to make pet food. But over time, you're going to see changes in the antigens or ingredients that are used in pet foods. One of the trends that we've been watching lately or seeing lately is this increased array of more exotic ingredients that are available, and pet food manufacturers are leveraging those ingredients and putting them into pet foods. Now, because some of these ingredients or antigens are ones that aren't commonly used, they're also being often leveraged through marketing to appeal to pet owners. And sometimes this marketing borders on suggesting that maybe these diets have some medicinal properties, such as can help with sensitive skin or can help with digestive issues. But I think it's really important for us to remember that over-the-counter diets are just that. These are diets that are made and designed to support health and well-being. That differentiates them from what we call veterinary therapeutic diets. And so veterinary therapeutic diets can certainly assist with different types of diseases. And we use veterinary therapeutic diets as part of our medical management in animals. And so the difference again there is that with over-the-counter diets, they're really intended for health and well-being, whereas veterinary therapeutic diets are intended to mitigate or potentially treat a disease process. And so all of the diets on this particular slide that we're looking at right here are over-the-counter diets, although sometimes they can look like they might be useful for treating medical conditions. And that can be confusing when you're in the pet food aisle trying to decide what you need. And so again, if you do feel like your animal has a medical condition, you should be checking in with your veterinarian and getting advice from them about what diet to feed. Now, when it comes to adverse food reactions, establishing a diagnosis is done by what we call an elimination trial, and following that up with a dietary challenge that can last up to 12 weeks. So again, what we do is we get an elimination trial going using ingredients that the animal has not been exposed to or a therapeutic diet that the animal has not been exposed to, and then follow the animal over a 12-week period. Some owners, if the animal is doing well on a particular diet, don't want to challenge the animal again, and that's okay. You're not required to challenge the animal. It's up to you and your veterinarian whether you feel a challenge is indicated. So when we do an elimination trial, the key to the elimination trial is really getting a thorough and as best as you can diet history. So listing food exposures is a very helpful thing. If you feel like your animal might have an adverse food response, writing down as many of the diets that you can remember your animal eating can be very helpful to your veterinarian, because then they can look for diets that are not the ones that you have used, or perhaps look for special ingredients in a veterinary therapeutic diet that are not included in the previous diets, the over-the-counter diets that your animal has been eating. So those lists are very helpful to your veterinarian in helping them decide what diet to recommend putting your patient on. So also you want to list all the supplements and medications that can be used. So for instance, things like HeartGuard, which many of us are giving to our pets, does have a beef flavor to it. And so that counts toward antigen exposure. We also want to know how you're giving the food and the medications. So for instance, if you are putting a pill or a medication into peanut butter, that should be recorded because again, that is an potential antigen source for your animal. Certainly the most common antigen sources that we're looking for are the animal-based protein sources because they're more commonly linked to adverse food responses than other types of potential antigens. And those include everything from cows or pigs or goats or fish or other animal species. So when it comes to elimination diet options, again, my preference is to use a veterinary therapeutic diet to help make that diagnosis and to see how the animal responds. That being said, you will see some commercial uncommon antigen diets on the market, but many of them are really truly over-the-counter diets because they're not designed to treat a medical condition. Again, they are simply health and well-being diets. You can also consider in a diet trial using a commercial or veterinary therapeutic hydrolyzed diet. So hydrolyzed diets are diets where the protein sources are broken up into very, very, very tiny pieces, and they're like less than 10 Daltons per molecular weight. And these broken up pieces of proteins, they're so small that we think that they escape detection by the immune system. And so that is how they work. So again, very, very tiny hydrolyzed diets, breaking up the proteins into very, very, very tiny fragments that escape the detection from the immune system. And then finally, you can go back, be a little old fashioned. Another tried and true approach is using a home cooked diet with limited ingredients. And when we do that, we usually pick one carbohydrate source and one protein source that the dog or cat has not been exposed to. And again, feed it for a long period of time to see how that animal responds. In cases where the animal does well, and doesn't have any adverse responses, whether they're skin or gastrointestinal, we might consider then looking to put that animal on to either keeping it on the home cooked diet for the remainder of its life, or look for diets that have those ingredients that the animal, it seemed to tolerate quite well during the elimination trial. So again, your options are to use veterinary therapeutic diets, which is what I would recommend. You could also consider using over-the-counter diets. Sometimes the thing that might be causing an adverse response in your animal may not necessarily be an antigen that, a protein antigen in there. It might be something else. And so just by changing some of those diets, sometimes the animals do well on those. But again, there are things that you should consider. Certainly the cost of veterinary therapeutic diets are higher than the over-the-counter diets in many cases. Some individuals feel that they don't want to feed foods from certain companies, and that's okay. You could consider, getting a home cooked diet made if you feel that, the pet food company diets that you have available, you don't want to feed those for whatever reason. Again, some people prefer to use the therapeutic diets because they come in cans and bags and they're much more convenient than home cooking. So again, when it comes to the veterinary therapeutic diets, very limited in their ingredients. Over-the-counter diets are essentially health and well-being diets. And so they don't necessarily disclose all the antigens that might be available in some of those foods. And again, just an example of where, looking at the package, this looks like this is basically sweet potatoes and bison. But again, when you look at the ingredient list, you're going to see more than simply two protein sources. You're going to see a sweet potato protein source, bison, pea proteins, potato proteins as well. So multiple sources in addition to just the sweet potato and the bison itself. So there have been a number of studies that have come out recently looking at applying PCR technology to over-the-counter limited ingredient diet categories. So again, over-the-counter diets, health and well-being diets. So there have been a number of us who have looked at those diets to see if they contain, what they contain in them, and do they always contain what they say they are. And so this slide represents a study that was done at UC Davis and published in Veterinary Medicine and Science in 2018. And in this particular project, we looked at a number of the over-the-counter limited ingredient diets to see if we were able to, if they always contained the antigens that we expected them to contain. And so what we found was that the presence of DNA from one or more species not declared on the ingredient list was identified in all of the 21 diets. So what we found was that all these diets had, they often had what they said they had, but they often had other antigen sources in them as well. So again, that's the reason why many veterinary nutritionists recommend that you use a veterinary therapeutic elimination diet if you are exploring adverse food reactions for your patient. So again, what diets to use for elimination trials? We select diets with limited number of uncommon ingredients and those that are known to be novel to that particular pet. Over-the-counter diets have extensive ingredient lists, and they're not ideal for elimination diets or for patients that actually have confirmed food allergies as well. So we do not recommend using over-the-counter diets for diagnosis or treatment. So when it comes to diagnosing food allergy, usually you run the trial for about 8 to 12 weeks. And at the end of the trial, if the animal's doing well, a lot of times the pet owner will say, I'm just going to keep it on the diet. It's doing well, and I don't want to play around with that. If the owner wants to try to get the animal off of the current diet that it's eating, then you can certainly challenge the animal with the previous diet and see if the problem recurs. If it is a food allergy, technically, when you re-challenge these animals, usually within about 2 weeks, you will see adverse responses associated with them. If you confirm a food allergy, you can continue to feed, and the animal's doing well on the test diet, you can certainly consider keeping the animal on that diet, especially just make sure that the diet is actually balanced and appropriate for the right life stage. So there's lots of ways that one can move forward after you make that diagnosis, and in consulting with your veterinarian and getting their advice is always appropriate. And I would certainly encourage you, if you are considering challenging or testing for an adverse food response, to contact your veterinarian and work with them through that process. So in summary, we often think about the animal and diet factors, but we also have to think about the environment, because oftentimes adverse food responses and atopy run together. So you might not just have an adverse food response associated with your animal, but you could have atopy as well. It's important that when you are doing a dietary trial to identify the historical and current antigen sources, and you do have to give some consideration to the type of diet that you want to feed your animal. Do you want to go with a commercial diet, a hydrolyzed protein diet, a novel diet, or novel meaning that the ingredients are novel or the animal has not been exposed to those ingredients, or a home cooked diet? Those are things that, again, working with your veterinarian, you can help make those choices and what's most appropriate for you and your animal. And then again, once you start a dietary trial, you want to maintain compliance throughout that trial, so that if you break compliance, then you essentially have to kind of start back over again and try again, whether it's with the same diet or additional one in the future. So that's all I have to say with regard to adverse food responses. Again, I would really like to thank the Pet Food Institute for the opportunity to be a part of their webinar, Mania. And I look forward to answering questions for you in person when that opportunity comes. I wish you all a wonderful day and take good care.